My name is Janina Ferguson.
Hello, my name is Charles Abandon, and we are P3s at Hampton University School of Pharmacy.
And our idea for the Wal-Mart Prescription For Service competition is to basically have a large-scale multidisciplinary health fair. What we want to do to promote the professional pharmacy is to lead by example and show our patients that pharmacy is included in optimizing healthcare for your patients, as long as the doctors and the dietitians. So we're going to have our pharmacy department, our nursing department, our physical therapy department, and then also an outside source for our dietitian section of the health fair. So starting with the pharmacy students.
The pharmacy students will be in charge of go over the patient's drug profile to go over any adverse effects of drug interaction that can be occurring to the patient due to the drugs. The pharmacy will also be in charge of going on the $4 list to see an affordable medication that you get from Walmart as compared to any other pharmacy locally. The pharmacist students will also be in charge of BMI, the cholesterol levels, and blood pressure reading. We will have the physical therapy students go over the foot exam, and they will also be in charge of exercise for the health fair. They will be in charge by doing Zumba for adults and using the bounce house for kids.
Now, the bounce house, we've already incorporated in our budget. We decided to add that to the fair to make it more family friendly and attractive. So we have a bounce house at $165 and another one at $199. This will promote active playing for the children, which incorporates exercise for the children in a way that they can relate to. We also want to spend some of our money to purchase blood pressure cuffs and glucose monitors. We will be purchasing both Relion brand. The blood pressure cuff is $40. We could probably afford about 20 blood pressure cuffs. And the glucose meter is $15. So we can afford about 20 glucose meters and then about 20 boxes of the 50 count test strips to go along with the glucose meter. That brings our budget total to $1,864. The printing supplies, the tablecloths, registration forms, flyers, raffles, gift baskets, and all the other miscellaneous prices will make up the remainder of the budget. The idea behind buying the blood pressure cuffs and the testing supplies is that our community that we're serving is an underserved community. So some of these people may not have these items at home, which limits them to their self-monitoring that they can do. So if we can give these away to some of the participants, then that will probably impact them the most. Now that includes our portion for the pharmacy and the physical therapist. We also have dietitian. This shouldn't take up too much of our budget. We basically want to have some pre-printed recipes for the diabetics and those who have high blood pressure and cholesterol. We actually want to have actual nutrition labels and products for things that people actually buy to show them what to get when they go to the grocery store. We also are going to have the nurses station. They will be doing the actual glucose screening and the diabetic testing instructions, making sure people are using their meters properly. And then basically we want to make sure this is a huge health fair, and we want to demonstrate that people have multiple resources to go to when they're trying to optimize their health care. And we want to make sure that they see pharmacy as one of those professions along with their doctors and nurses and dietitians. So basically we want to make sure we have a large-scale multidisciplinary healthcare fair which promotes pharmacy in conjunction with the other healthcare providers.
We would like to get as much participation as possible, so we reach out for the local news channel, and we will be in conjunction, work with the local free clinic, that to advertise this health fair to the whole community to come out and be a part of.
So basically that's our project in a nutshell, and I want to thank you for your time.
And I'd like to thank you for this opportunity.
And again, we are P3 students from Hampton University School of Pharmacy.